Thank you all for joining me today. As I said Friday, staying at home has allowed us to not only reverse an exponential increase in our new case rate, we've cut that rate in half. And that bought us precious time to deal with the overwhelming challenge of COVID-19. When it comes to a crisis, preparedness is everything. And Pennsylvania has a great team working behind the scenes to coordinate our response. I've asked Randy Padfield, the director of the Pennsylvania Emergency Management Agency, to join us today to provide a little more detail on our response. But I want to reassure all Pennsylvanians that we are in good hands with the team at Pima. This team, along with the Department of Health, has been monitoring the virus since January. Here at Pima's headquarters, the Department of Health's Operations Center was established even before the virus was first detected in the United States. And Pima's Commonwealth Response Coordination Center stood up full operations just a few weeks later, supplementing planning and coordination efforts with staff from dozens of state and federal agencies and partners. These partners include the American Red Cross, as well as other vital volunteer organizations. Across the Commonwealth, Pima is working with the diverse emergency management agencies in each and every one of our counties to identify and eliminate potential issues by providing the necessary guidance and support to execute their local emergency plans. And Pima is working hand in hand with the Pennsylvania National Guard on its missions, which vary from food distribution to nursing homes to establishing mass testing sites. One great example of Pima's ability to facilitate problem solving is the rollout of the Battelle Critical Care Decontamination System. Like other states, Pennsylvania had initially hoped to increase our stockpile of personal protective equipment, but soon found that suppliers could not keep up with the demand of our medical professionals. When the Food and Drug Administration issued an emergency use authorization for the Battelle system, Pima worked with the Federal Emergency Management Agency to bring a Battelle system to Pennsylvania. The Battelle system can decontaminate certain N95 masks up to 20 times, and the cost of the system is covered through the U.S. Department of Health and Human Services. The Battelle system is a great way to increase the availability of clean N95 masks, and I encourage organizations to take advantage of it. It's just one of many programs that Pima has helped facilitate with little fanfare. Pima is quietly effective. We know they're doing a good job when we don't hear much about them. And I can say that has been the case so far during this crisis. There's a lot to worry about during a pandemic, but Pennsylvanians have not had to worry that we'll miss out on federal disaster aid. They haven't had to worry about 911 centers becoming overwhelmed. And they haven't had to worry that other emergencies won't be taken care of during this pandemic. That's all because Pima has efficiently and effectively done its job. So I'd like to thank the hardworking employees at Pima for all they've done over the past 5 months, working a scenario that they've never faced before. The training and planning that they do year-round is tested during exercises, and all of that experience is being acted upon now. So thanks again to Pima for all of the good work they do.